I'm scared of spiders. What are you scared of? Let's go find out.
I have a fear of heights. Just that it's more of like, I don't know, an internal thing. Like if I'm in an airplane and like I get a little nervous and taking off. I have a fear of heights. I literally hate Ferris wheels or being up in high spaces. I don't like looking down. I think it's just really scary because I feel like I'm gonna fall.
I have a fear of heights. I don't know what what phobia name it is.
Oh, fear of heights. So it is acrophobia. Okay. So do you get really scared when you're at the heights? Or?
Yeah, I get scared.
What kind of symptoms do you have?
I feel really dizzy. Like I don't like looking down, seeing the floor. Just
Okay.
like I think I'm gonna fall.
Oh my goodness. Okay.
I have a fear of heights. I tend to get really nauseous and sometimes I'll faint.
So I guess my fear would be bacteria, since there's so much we don't understand, and there's constantly creating new ones and whatnot. So probably that, since we just saw what happened with COVID, and there's a lot more out there.
I guess my fear would be without being a cell phone or any sort of communication system.
I have a fear of losing my loved ones and my belongings.
Welcome back. So let's talk about what is phobia. So today I went out and I was talking to people about different kind of phobias they have. So we found out that the most common phobia is acrophobia, which is the fear of heights. Let's talk about phobia in detail today. A phobia is the uncontrollable and irrational fear of some certain object or any situation or some kind of activity. The fear can be so much overwhelming that the person starts avoiding the source of the fear for long period of time, and it can be lifetime. Let's talk about some of the types of phobias. So let's get started with agoraphobia. Agoraphobia involves the fear of having a panic attack in a place or situation in which the escape can be difficult or embarrassing. Some people think like they cannot escape from a place where they at. For example, when they are outside of the home, or even when they are home alone, they feel like trapped. They feel like something wrong is gonna happen to them when they are alone. Being in a crowd, traveling in a vehicle, being in an elevator, or sometimes on the public places like bridge. So people with agoraphobia normally avoids any kind of places where they think the escape is going to be difficult. So don't confuse it with social phobia, which I'm going to talk about it next. Social phobia is the anxiety about social situations in which the individual is exposed. For example, when they are outside in a conversation, in the meetings, or some unfamiliar people. People with this kind of phobia, they think they are being observed every single time when they are eating, when they are drinking, or when they are performing something in front of people. For example, giving a speech. When giving a presentation, they get panic attack. They feel like something's wrong is going to happen to them. Only because they may have underlying social phobia. Next, let's talk about acrophobia, which if you see is the most common when we did the public survey as well. Acrophobia is a mental condition in which the individual experiences intense fear of the heights. These kind of people often avoid the situations or places that involve heights. For example, walking up a flight or stairs, being on a ladder, using a multi-level parking garage, sometimes on a bridge or roller coaster. They will be panic if they are standing in the balcony of the building or they are looking outside of the tall building. Next, let's talk about the statistics of phobia. If we look statistically, the most common phobia is the acrophobia, which is found in the 28% of adults, in which 32% in women and 25% in men. And 34% it's found among the pre-pubertal children aged 8 to 10 years of age. So there are total 600 different kind of phobias. We cannot talk about all the phobias in detail, but I can give you some example of some of the common phobias. Fear of spiders or insects, which is called arachnophobia. Fear of needles, trypanophobia. When I order some lab work for my patients, I say this pretty common. Fear of sex, erotophobia. Fear of germs, germophobia. You must have seen during the time of COVID, but some people are normally washing their hands. They are kind of germophobic as well. Fear of being without cell phone, nomophobia. And this is what we came across in this video. Fear of strangers means xenophobia. Fear of losing things. It's called disposophobia. And we came across this kind of phobia in this video. When this kind of phobia gets extreme, people may have hoarding disorder down the road. And last, fear of losing loved ones is called thanatophobia. You will see this kind of worry or fear when people experience a death anxiety. So what are the symptoms if somebody is experiencing phobia? So some of the common symptoms if person experiences phobia are changes in the heart rate, sweating, feeling hot or sometimes chills. Next, shaking or trembling. They may also experience nausea, upset stomach, sometimes tightness and pain in the chest, trouble breathing or feeling dizzy or lightheadedness, feeling like you're gonna faint or blood rushing out of the face. These lot of symptoms we came across in this video during the survey. Next, let's talk about the management of phobias. And phobias interfere with the person's life, cognitive behavioral therapy or CBT with exposure treatment is advised. In exposure therapy, people are gradually exposed to what they are scared of until the fear starts to fade. Relaxation and breathing exercises also are done at the same time to help them with your symptoms. The goal of this therapy is to desensitize the fear that the person has. So if we avoid the fear, for example, if you don't want to go on the ride and every time you come across, your fear becomes bigger and bigger. Instead of avoiding, a person is exposed to the different situations that he or she has the fear. The exposure can be real, where you actually go to the place or the therapist creates the scenario in your mind with the different techniques they use. When the person gets exposed to that fear, a therapist uses some techniques to desensitize those fears. It's very, very helpful, and a person with phobia gets a great advantage, a life-changing technique to deal with the phobia. And that's all about today's video. I hope you guys like this video. I'll see you guys next time with a different public survey. Stay tuned and take care of your mental health and those around you. Bye bye.